Welcome back, Michelle. Great to see you.
Hey, Dan, how are you?
I'm good. We are back in person at the studio here.
Love being in person.
Yeah,
I love
always.
both, actually.
They each have their own kind of sets of pros and cons, but we do get to see each other in person, which I feel like lets us talk more about things.
Yeah, and touch things. I mean,
Oh
we have
yeah,
these little cute bags to talk about today.
we do. We're going to talk about these. These are for those of you who attended our Tired but Not Sleepy event, which was, gosh,
March.
do you know it's already halfway through, like 2025? That's kind of crazy to me. Like by the time this episode hits, it'll be in the middle. We're in the middle of season. We're in season 5, I think.
Yeah, giving you also
Yeah.
the date of our next in-person event is August 23rd.
Oh.
It's a Saturday evening.
Oh.
Okay, we are pairing with a conference, a regional conference on sleep called Current Concepts in Sleep Medicine, and Keep Pinellas Beautiful.
Oh.
And we're going to be walking on the beach. And if you happen to find some trash or something that doesn't belong on the beach or something somebody left that doesn't belong on the beach, we're going to get rid of it and keep our beaches clean.
I love
So,
it. Physical activity and better sleep.
correct. Now, it's August. So, we all are in Florida thinking about hurricane season.
Mm-hmm.
It's going to be a season. If there's bad weather, then we will be indoors at the hotel where the conference is happening. And there will still be physical activity and still be meeting each other and still be celebrating sleep, but it will be without weather being inclemented. If there's a hurricane, we'll all be somewhere else and we'll have to move the date.
We'll figure it out. I feel like this is the thing. Like you never know what storms are gonna do. So nah, you just kind of roll with it.
Right, but that's exactly what we talk about on this the whole podcast.
Yep.
You aren't planning, this banquet wedding. When you listen to Sleep Takeout, it's not a full course. It's learning things that you can do and implement immediately that will help you mostly immediately.
Mm-hmm. Absolutely. And that's what we're going to talk about today. We're going to review some things and then dive into part 1 of CBT-I Session 3. For those of you who've been following along, I feel like almost all year or so far we've been talking about.
Session 3 is a big one, and we
Yeah.
realized that we've been having a little bit of extra long episodes, and so we're going to separate it out a little bit.
We are, but it'll be good. So part 1, we're talking about sleep meds. Part 2, we're going to talk about a lot of the cognitive, mental, your brain energy part, like the part where if you can't get your mind to shut down, we got some strategies on that. And then get another plug for in the future, we're also going to create the ultimate guide to anxiety. So that's keep an eye out for that one when that podcast episode is going to be ready. So, but for now, we're going to do kind of the strategies within CBTI for managing that. But that'll be part 2 of episode 3. So
yeah, so let's talk about this bag first, okay? For those of you that are going to be seeing us in person, we will have these bags available, and
free stuff.
And I'm going to just kind of pull some stuff out, and you're going to tell me why it's included in there, okay?
Oh, yeah. So for those of you who remember from earlier, I would say actually our last session of CBTI, and then also those of you who attended our Tired But Not Sleepy kind of basket events, it's always important to use multiple kind of sensory pieces in terms of helping you to manage stress and those types of things. And one of the things that we know about sleep, specifically with anxiety around sleep, is that learning to become aware of your thoughts and then be gentle with them instead of kind of negatively judging them is a key kind of skill here. And so we're going to start with
Raisins?
a mindfulness exercise. Yes, a little teeny tiny. It's kind of really cute, by the way. I think they're adorable. The world's kind of, I don't know if it's the world's smallest box of raisins, but it is a teeny tiny box of raisins there.
I might have a Barbie version that's a lot smaller.
You probably
than
do.
this.
There's a kid toy thing too that's called, oh, I lapse on the name, but my daughter was really into it, where there's like little micro food items.
Nice.
It's like, yeah, super, super tiny. I can't remember what it is. But so we got a box of raisins. We're going to do that exercise. Should we start with that and then go through the rest of the bag?
Sure.
Okay. All right. So let's start with our raisin exercise. And those of you who are following along, if you've got a box of raisins at home, and Michelle, I'll give this to you because you're going to use this in just a moment. And the goal with this exercise is just to become aware of all the things that kind of come through your mind. So what I want you to do, Michelle, I want you to open up your box of raisins right now and go ahead and pick out one raisin. You've got like several, so you can choose one. And now that you've got your raisin there, I want you to hold it up to your face and just kind of so you can see it. I just want you to notice the shape.
Remember, I'm getting older, so I have to hold it a little farther away.
You're like, where'd it go? It moved around. So hold the raisin up. Notice the shape of your raisin. Notice the colors of the raisin. Maybe if the light hits it differently when you move it around. The contours of your raisin. Is it all smooth? Is it wrinkly? And I want you just to notice these different parts of the raisin, including, I want you to kind of go ahead and put it in your hand and just notice the weight of that little raisin, or maybe the lack of. I've had several clients be like, I don't feel it. But I just want you to notice this raisin right now. And I also want you to notice the feel of it against your skin, against your fingers right now. And I want you to just gently squish it, just a teeny, teeny amount, noticing the texture of this raisin. And now, I want you to go ahead and hold it up to the light. So hold your little raisin up to the light there and kind of take a look at it. And notice how it may glow as some light kind of passes through. And now, I want you to take that raisin and gently bring it to resting right under your nose right here. And just kind of smell the aroma of that raisin. Just notice it. And then I want you just to gently bring it to your lips on your mouth and just hold it there. I don't want you to eat it yet. A lot of times when I do this exercise with clients, they'll just kind of chomp right into it. But I want you to notice that raisin against your lips. And I want you to pay attention to what's happening inside your body right now. I want you to notice maybe if there's more saliva that might be showing up in your mouth. I want you to notice if you've had maybe the urge to bite it or not. And in a moment, you are going to get to bite that raisin. So for those of you who are following along at home, you're going to get to bite it in a moment. But what I want you to notice is what you're doing is you're just noticing all the sensations that come with this raisin. And so now, in ultra slow motion, what I want you to do, I want you to go ahead and bite the raisin in half and just notice what your teeth do. And just kind of let the raisin sit on your tongue there. And again, notice what's happening inside your mouth. Notice if there's more saliva in your mouth, or notice if your tongue is doing something without you even thinking about it. Notice if your jaws or chewing action is kind of happening. Notice all of these sensations. And now I invite you just to go ahead and close your eyes. And I want you to go ahead and just start gently exploring the raisin with your tongue in your mouth. Just notice the
It
taste.
disintegrated.
If you need more raisin, feel free to add more raisin in your mouth. But notice the taste in your mouth and the texture. And now go ahead and chew up your raisin. And as you're doing that, notice what your tongue is doing. Notice your jaws. Notice any sounds of chewing that might show up for you. And also notice where you can taste the different flavors of the raisin. And when you do swallow, I want you to notice the movement as you've chewed that raisin and now swallowed it. It's probably mixed with some saliva in your mouth there, and then you gently swallow it. Just notice where you feel it, maybe as it goes down your throat. And then notice where your tongue goes once you've swallowed the raisin. And then notice maybe where the taste kind of gradually fades, or maybe there's a little bit of raisin stuck in one of your teeth, and you notice that too. Notice your tongue moving around towards it. And again, all of these things are just simply to allow you to pay attention to something that we usually do so quickly, like eating, that we don't even pay attention to what our tongue is doing, what our jaw is doing, what smells can smell like, what tastes can kind of taste like. And now, what I want you to do is I want you to go ahead and finish up the rest of your raisin there and go ahead and swallow. And then whenever you're ready, just kind of join me right back here, back on the podcast here. All right, Michelle, now deep dive about that raisin. What was it like?
Well, I've done this exercise before.
Mm-hmm.
And what I think is very interesting about including it in a sleep one is it is getting you to slow down. And I think that is probably the most important, is just recognizing all the things that go into slowing down a repetitive habit that you have.
Mhm.
It's like M&Ms, like how many people just eat one? So it doesn't have to be a raisin. It could be really anything. But not necessarily around sleep, but maybe we talk about this closer to like an after dinner kind
Oh
of wind
yeah,
down
of
that you could
course.
do with even liquid
Oh yeah.
or something else that's in this bag,
What? There's more in the bag?
which is tea, like some herbal
Ooh.
teas. But what's really interesting is these are some of the freshest raisins I've ever eaten,
Oh wow.
and they dissolved
Here you
quite
go.
quickly.
Sun-made.
I'm used to very apparently like hard and chewy raisins, and these were very, very soft. So,
All right.
but you could do it with a grape, you could do it with a cranberry, I
Mhm.
could do it with anything that you're thinking about.
Exactly.
But I do like the idea of slowing things down before you go to
Mhm.
sleep.
Yep.
And it was multiple sensory. So the
Yes.
taste, the touch, the smell,
Mhm.
the sound. We got the sound in there.
We did. Sound can be a challenging one because we want things that kind of, to
I'm getting
activate.
I'm getting a little bit of sound with these
Your tea
two
bags.
tea bags. Now these
Yep.
also smell quite good. Some smell like lavender.
Oh yes. There's more in the bag that might smell a little lavender. Go ahead and open the mint one. I think peppermint tea is rather interesting. So we've talked about this a few times on the podcast before about
Notice the sound.
yeah, and it's another kind of activity where again the goal here is not to consume a lot of liquid, but it is just to enjoy the experience of tea. So
Mhm.
whether it's, the smell of it, holding a cup of hot tea in your hand, which usually is again a small amount of liquid, um, but the sensory experience of it and then swallowing it, all those pieces can be another helpful kind of um, bedtime routine, something you can do to help you calm down to enter into that rest, as well as something you do in the middle of the night when you're tired but not sleepy. And a key thing with tea is you want to make sure it's not caffeinated. So the herbal teas are great for this.
Yeah, in general, or anything that says herbal tea, not decaffeinated, herbal tea is
Hmm.
usually good. Now, sometimes it has herbal tea with electrolytes. You'll start seeing some of that pop up. Um, and some of the electrolytes probably could be helpful, but I would say stay away from anything that's like recovery,
Hmm.
post exercise. Just work on just herbal.
Yeah. Yeah, I would say I've noticed this too in the tea aisle. There's been a lot of sleep branded tea things,
Mm-hmm.
teas with like added melatonin and other types of things. And I would say my bias is I would just say stick with the all natural, like just herbal tea. Like the tea doesn't need to be infused with melatonin for it to work.
Mm-hmm.
So the more you can just kind of stick with the all natural, the better. That's
Mm-hmm.
my opinion on that. Um, the next thing on here, again, you were mentioning another sensory smell there is a candle, which we got here, these little lavender tea lights, which do smell quite amazing. I
Mm-hmm.
love how they smell. Actually. It, good. Smells like good lavender there. It kind of makes everything in the bag kind of smell like lavender. But you can kind of light the candle. Although this one's so nice, you don't even have to light it to smell. You can kind of get that smell right now.
Yeah, I like putting the candle warmers,
Oh
with
yeah.
the lights, so then you don't have to worry and you can set it on a timer. So that
Yep.
part's nice.
Absolutely.
But if you're using candles for sleep, make sure that you put it in a safe spot. A lot of times, if it's in a type of vessel that has a cover to it, when it burns out, it just burns out. So, but if you're going to be going to sleep, just again, safety first.
Hmm. Absolutely. And then the last thing in here is for those of us who have a little bit more kind of cognitive energy at night. And I found these on Amazon. I think they're super cute, by the way. We should use these again. We should do things. But it's called a tangram, tangram. And they're actually party favors for like a kid's gift bag if you throw, a kid's birthday party and you need things. Um, but what's super fun about them is that they're little wooden puzzles. And I don't know if here, we'll put it all the way. I don't know if it'll fully show up on here. But, um, but what it is, it's just a little wooden thing and all the pieces pop out and you can create different, um, different designs on things. So you can create an arrow, you can spell out all the numbers, like 1 through 9, you can create a heart, a windmill, a house, a key, a woodpecker, a rooster, a
So there's
giraffe.
like 20, 30 different things you can
There's
do.
so many different things on here. And what's nice about it, you can create a hot air balloon, a spaceship, a flower, a baby stroller, a helicopter. There's so many cool things on this. What's nice about it, though, again, is just like for some of us that, we've talked about like jigsaw puzzles and those types of things before, the purpose of this is you just want to do things that when you're tired but not sleepy that are just, they're not too activating. They're not things that are really complicated. Like you don't want to do something that's naturally really exciting for you. You kind of want to do things that are slightly boring. Things that are like, you know what? I'm awake in the middle of the night. I got out of bed. I got out of my bedroom. Great job, by the way. Virtual high five to all of our listeners and watchers around who have already accomplished that step. That's a really important one. And then you do activities like this where you have them in your tired but not sleepy basket or the bag that we have that we're giving away. Again, the goal is the combination of these things is what you have to really figure out for yourself. But there's so many different activities that you can do with being awake in the middle of the night and you're tired but not sleepy. So
Really fun.
yeah. So again, this is meant just to kind of be symbolic for you to see what the potential ideas are out there. It's not meant to, be exhaustive by any means, but definitely look for those bags at our next event because they'll be there. So, which brings us, Michelle, to what we're going to kind of talk about today with session 3 for CBT-I is we're going to talk about sleep medications. And, what's really kind of important about these sleep medications is really, Michelle, and maybe you can kind of, talk about this because there's some really relevant parts that we want to know is number one, like who prescribed it, what's the dose, when do you start taking it, how often do you take it? And really a key question that I'm kind of highlight here that's I think super relevant when we're talking about using your sleep medication as a safety behavior is, do you take it just when you go to bed or do you take it after you first try to go to sleep and then wake up in the middle of the night and can't go to sleep? So it's really interesting to kind of understand how the medications themselves work, and maybe you can kind of touch on that, and then how our behavior around medication also works.
So there's a lot packed into there. And you brought up a really good point is who takes medication. Now, as a sleep specialist in my regular life, a lot of people will come in and say, hey, I've tried everything on my own and I feel like I need medication. And it's important to kind of work backwards on what does that mean? But it also may be, hey, I've been taking medicines and they're not working. So figuring out, the who, the what, the why, the two most common medications, and again, maybe a definition of medication is something taken for an intended effect.
Mm-hmm.
Because in sleep, sometimes it's alcohol, or it could be marijuana, or it could be antihistamine, like Benadryl, or some of
that's what that Unisom stuff is, right?
Yeah, fancy Benadryl, doxalamine's another one of those. But really, it's important to know that anything that you take and put in your body with the intention of having a side effect, be it food or like a substance, could be it. So it's important to know. Now, many times, things that slow your brain down are also used for other things.
Mm-hmm.
Like in the neurology world, people use it for seizures. So the most common medicines that have been used are in the antidepressant family and also in the category of these neurologic slower downers that we use for seizures, like Valium, for example. So, over a lot of years, the people who deal with sleep issues are going to be like a primary care doctor. But when it starts involving these fancier medicines, you might call on a sleep specialist, someone who specializes in that field of sleep, or the neurologists or psychiatrists that are very comfortable prescribing these medicines.
Right.
Have you seen that a lot?
I have. I would say probably the most common medicine that I see that people are moving, because people have moved a lot away from the Ambiens like those. The more common one that I would say I see a lot of these days is trazodone. And using trazodone, like lower dosage of it, I mean, because it's an antidepressant and the higher dosages, but in the lower dosages, using it as that sleep coach.
Yeah, so let's talk about that. Trazodone was the #1 prescribed medicine for the entire decade of the 70s.
Oh, wow.
And you see it coming back because it's not a controlled substance.
Right.
So trazodone, in addition to its antidepressant category family, it also has an alpha-2 blockade, which blocks the adrenaline surges and these hypersurges and can cause orthostatic hypotension. So, we have a lot of people that are taking medicines and have high blood pressure, or maybe have like a postural hypertension, like the POTS type of syndrome that developed a lot post-COVID. And we're giving them actually more side effects from the unintended consequences of these medicines. But after trazodone from the 70s, that's when Ambien was developed. And Ambien was the first, so it's called Zolpidem now in the generic form, but it was the first one that was the benzodiazepine receptor agonist. And many people don't know this, but I hope that our listeners are very savvy and have listened to some of the early episodes on it. But when you agonize or when you bind a receptor and you don't actually create the same molecule, like a benzodiazepine, you don't build up the amount of receptors that your body has. So it's less habit forming and there's less potential for it. And there's less tolerance that develops.
Right.
So if you use a benzodiazepine for sleep, I think about Xanax and Valium and Klonopin and Restoril, which is temazepam. So a lot of those PAM type of medicines, you're actually creating your own worse sleep problem by creating a tolerance in addition to the dependence that you have.
Right.
So not only will you have a lot more trouble getting the same benefit from the medicine that you've been taking, but if you decided that you'd like to stop it or you run out of it, you're creating that cycle where you need the people to keep prescribing it to you. And you're going to need more medicine to get the same effect. Whether or not anything else changes, that's just how your biology works internally.
Right.
Ambien and Lunesta, which were the two original benzodiazepine receptor agonists, do not have that. So you can stop and start them, and you're actually not creating a tolerance or a dependence to it that is physiologic. Now
psychological dependence.
Psychologic, and this is where we're getting to this, that why cognitive behavioral therapy for insomnia outmatches, outwits, outperforms indefinitely medications is because there is another component to just binding these GABA receptors and making you more sleepy. So there's other family of medications that's not in those PAM type of categories that was approved for sleep. Also worked on the same properties of those antidepressants that make people sleepy. So at lower doses, they tend to give more sleep effects without the antidepressant qualities. And they tend to wear off a little bit sooner than the traditional antidepressants that make people very sleepy all the time. It's like trazodone. Trazodone, by the way, and you know this too, it's a big weight gainer. So
metabolically, there's issues.
There's a lot of things, but Doxepin was branded as Silenor in 2010 or so. It was the first not controlled substance that was a very low dose, actually lower than any dose that was ever used for itching in the antihistamine type of family or the antidepressant properties of the very higher doses. And it was approved for staying asleep. So not falling asleep, but staying asleep. And then there's another medicine called Roserum, which is now generic. It's also called Ramelteon. There are 3 melatonin receptor agonists. Now, we've talked about how melatonin doesn't work for everybody, or some people, it doesn't help them sleep, but it gives them like terrible nightmares. But that certain people, particularly as people get older or when we're getting all this extra light, they may not respond even to their own internal melatonin, but 2 of the 3 receptors actually make you sleepy. All right, and then the last class of medicines that I want to talk about is a newer class. It's these orexin agonist antagonists. And orexin is one of those chemicals that's you probably heard of because it's deficient in narcolepsy. But what it does is it keeps you awake. So if you have not enough of it, you have effectively narcolepsy. and you're sleepy more of the time, almost all of the time. Doesn't mean you're sleeping well, doesn't mean that you're able to stay awake during the day, but you're sleepy. So there's now 3 of those medicines that don't produce more sleep. They take away your wake up chemicals. So they can make you not as aroused in your brain and awake, so that it makes it easier for your sleep chemicals to overcome, assuming that you're active enough in the day and that you're not doing all the activities that would, again, try and wake you up. Because we have a lot of arousal chemicals. Think about like the dopamine and the norepinephrine. Orexin is one of our wake up chemicals. And we don't tend to use that up as the day goes by. So taking that away ends up helping us get to sleep. So that's just a very, very short overview of medications that we've used. And we use a lot of things like heart medicines and medicines for pain. Even Tylenol can help people sleep. So when you think about, hey, am I taking this specifically at night, specifically for sleep? That is something that you want to just reflect on. Is this the right time to take it? Am I taking something in the morning, maybe like vitamin D, for example? If it makes you sleepy, we try and move it to the appropriate time to take it. Or maybe, something that you don't take as often because you know that it creates a sleep side effect. But be careful with any of these things. Medicines are tricky. For every amount of good, there's a bad, and there's a reason, again, I've said it before, that CBT-I, hands down, works better for chronic sleep problems than a medicine ever will. Medicines were developed as a very fast way to fix an issue somebody was having. They were never meant to be long-term. Even the ones that have been deemed safe for long-term usage were never meant to be used for months, years, decades, as many people with sleep medicines are on.
Right. Wow. Thank you, Michelle. That was a helpful overview of all the sleep kind of medication. So we're going to dive into part 2 of this kind of next time. And we're going to take a deeper dive into the mind and the worries and that cognitive kind of energy or that hyper arousal. So
yeah, not to scare you about medicines, but really the answer is, and if you're here, you know this, that it's not going to be medicine that's going to be a fix, but know that there's a lot that is pushed to try and make them seem like a really good idea.
Yep. All right. Until next time, Sleep Nation.
All right, bye.
Bye.